Thank you, Sir Henry. And can I say right at the very start, it's a pleasure to serve under your chairmanship for the very first time in my last appearance in this particular room. And as my next-door neighbour for the last 18 years, it's been a pleasure. And I'm pleased to move the motion. I beg to move that this House has considered the 7th report of session 2017-19 of the Science and Technology Committee on e-cigarettes and the government's response. Now, I'm pleased to have secured this debate to discuss this really important work undertaken by my committee before this Parliament draws to a close. And it's great that we've been able to hold this debate in the month of Stoptober, which is the big anti-smoking initiative, which has, I think, been a successful initiative and which I remember launching in my time as a minister back in the day. Now, in England, statistics released by the Office of National Statistics showed that in 2018, 14.4% of adults smoked, and that in itself is a very significant achievement and advance in reducing the prevalence rate of smoking in our country. ONS figures from 2011 onwards show that smoking rates in England have fallen every year since then. It is important to make one exception, which I will come back to, and that is mental health, something that I care a lot about. But we know that people with severe and enduring mental ill health tend to die much younger than other people, and it can be as much as 20 years earlier than others. And one of the key reasons for that is the prevalence rate of smoking, which is around 40%. So whereas we've been very successful in reducing smoking rates in the population as a whole, we have not been successful in terms of those with mental ill health, and I will return to that. Now, in Great Britain in 2018, there were approximately 3.2 million vapers, 6.3% of the population, and this in itself marks a significant increase in the number of vapers, which in 2014 was 3.7%, so a significant increase over the last 4 years. But why does this matter? Now, the Tobacco Control Plan stated that, and I quote, "Tobacco is the deadliest commercially available product in England." It's really important to hold on to those words, the deadliest commercially available product in England. That's from the government, with tobacco regulations serving to safeguard people, particularly children and young people, from the avoidable premature death and disease tobacco use causes. Indeed, in the recent Prevention Green Paper, clearly articulated, some people are disproportionately more likely to smoke. Smokers are disproportionately located in areas of high deprivation, something I think we should all be deeply uncomfortable with. In Blackpool, 1 in 4 pregnant women smoke. In Westminster, it's 1 in 50. What an extraordinary contrast that deprivation is causing, and that causing that significant risk to a mother's health and to a baby's health. And according to Public Health England, and I quote, "Vaping is at least 95% less harmful than smoking," close quote. This does not mean that vaping is safe, and it certainly does not mean that we should be encouraging non-smokers to start vaping. But compared to smoking, vaping, on all of the evidence we have so far, is considerably less harmful.
Will the Chairman...
I will.
I'm grateful to the Chair of the Science and Technology Committee, and I'd like to put on record my thanks for his time as chairing it. It's been an interesting period where we've got into great detail and I think effectively on many subjects. But he mentioned NHS England, and I was annoyed that NHS England, who have the time to put out quite often crass and obvious statements on health, did not have the time to come and give us their advice on e-cigarettes, which is as the honourable gentleman is saying, is one of the ways of getting people to stop smoking.
Well, I thank my honourable friend, I will say, because I'm DMOP happy and I don't care about the normal rules. That it's been, first of all, it's been a great pleasure to work on the committee with him, but I also share his concern there. Given that the government's own control plan, tobacco control plan, describes it as the deadliest commercially available product in England, one would have hoped that the body that runs the NHS in England would show a very clear and strong commitment to confronting that potential or that clear risk. But despite the fact that it is very clear on all of the evidence available that vaping is very significantly less harmful than smoking, I nonetheless absolutely encourage research to continue in this area, because we should always be alert to anything that indicates potential risk. And that's exactly what our committee incidentally recommended. Now, e-cigarettes are not only less harmful, but they appear to be an effective stop smoking tool, as the honourable member made clear. A study published earlier this year in the New England Journal of Medicine randomly assigned adults attending UK National Health Service stop smoking services to either nicotine replacement products of their choice, including product combinations provided for up to 3 months, or an e-cigarette starter pack. That study of 886 participants found that the 1-year abstinence rate was 18% in the e-cigarette group, compared with 9.9% in the nicotine replacement group. That is a really significant difference, and we need to make sure that we act upon that difference. Now we have the knowledge of its effectiveness as a stop smoking tool. Now, results from a 2019 survey carried out by YouGov for Action on Smoking and Health, known as ASH, found that, and I quote, the 3 main reasons for vaping remain as an aid to quitting, 22%, preventing relapse, 16%, and to save money, because people who vape spend much less money than people who smoke, 14%, demonstrating that users perceive e-cigarettes as a stop smoking tool. Therefore, e-cigarettes are likely to be helping the government to meet its ambition announced in the government's Prevention Green Paper for England to be smoke-free by 2030. Nonetheless, I accept, as I've already said, that further research is needed on the effectiveness of e-cigarettes as a stop smoking tool. So I'd like to ask the Minister, will the government or one of its agencies request further independent research on the effectiveness of e-cigarettes as a stop smoking tool? Now, an issue we highlighted in our report was smoking cessation in the NHS. Recent research from Cancer Research UK has highlighted that primary care clinicians face barriers in discussing e-cigarettes with patients who smoke. 1 in 3 clinicians, this is extraordinary, I find, I have to say, Sir Henry, 1 in 3 clinicians are unsure if e-cigarettes are safe enough to recommend. Now, given the death toll from smoking, it's extraordinary that it appears as if clinicians are unaware of the clear advice from Public Health England in that regard. 2 in... I will.
I agree with everything he said, actually, in his speech thus far. Would he agree with me that one of the ways that the government can reach its ambitious target that's been alluded to by the Right Honourable Gentleman is by actually embracing vaping, by getting more information out there to the clinicians that he's spoken about, and working through the law, particularly post-Brexit, to ensure that people who want to give up smoking have the full information they require in order to take up vaping instead?
Well, I thank the honourable member for the intervention, and I totally agree with the point he makes. These statistics that I'm quoting make the point that raising awareness, even amongst clinicians, we thought it was just the general public who needed to understand better the relative risk, but clearly clinicians also need to understand the relative risk so that they can advise their patients more effectively. 2 in 5 feel uncomfortable recommending e-cigarettes to their patients who smoke. Again, an extraordinary finding. Fewer than 3 in 10 agreed that their current knowledge is enough for advising patients about e-cigarettes. Extraordinary data there, and recognising, I think, a clear need for the raising awareness that the Honourable Member mentions. So what assessment has the Minister made of the number of smoking cessation services in the NHS that are actively promoting e-cigarettes as alternatives to conventional cigarettes? It ought to be every single one across the country, but are they actually doing it? Do we know? Secondly, can the Minister tell us what work they are doing with NHS England on increasing knowledge amongst clinicians of the uses, benefits and risks of e-cigarettes for current smokers? Now, we recommended in our report that NHS England should create a post for someone who is responsible for implementing the government's tobacco control plan. While the government said in its response that it broadly accepts this recommendation, no specific steps to implement our recommendation were set out. We pursued this with NHS England, who told me in January that, and I quote, "It is our intention to appoint an individual with lead responsibility for this role. This will be an important part of our delivery programme for the NHS long-term plan." Close quote. Now, we would all assume that that person has been appointed a long time ago and that there is active work now underway to pursue this vital agenda, which will save lives. But I would like the Minister to confirm that NHS England has created this post, and if they have, is someone actually in post doing the job? Now, in the government's long-term plan, provision was made for, and I quote, "all smokers who are admitted to hospital being offered support to stop smoking," close quote. This is not due to be fully implemented until 2023-24. Again, given the extraordinary health benefits of stopping people smoking, I would have hoped for a tighter timescale than 23-24 to implement that. But can the Minister tell us how implementation of this proposal is going and whether consideration is being given to fully implementing this before 2023-24? Now, we also recommended in our report that the NHS should have a clear policy on e-cigarettes in mental health facilities, which establishes a default of allowing e-cigarette use by patients. Now, this comes back to my point that 40% of those with severe and enduring mental ill health, approximately, still smoke. And so the attitude and culture within mental health trusts is critically important if we're to enable people with severe and enduring mental ill health to help them give up smoking. So we said that this should be the default, that e-cigarettes should be made available in mental health facilities unless there are clear evidence-based reasons for not doing so. In its response, the government said that, and I quote, "NHS England will provide guidance to mental health trusts that sets out that existing vapers should be permitted to use e-cigarettes as part of smoking cessation programmes, and tobacco smokers should be supported," and I quote, "to stop smoking through smoking cessation programmes." So can the Minister tell us, has this guidance been issued? I very much hope it has. If not, when will it be issued? And what's the reason for the delay in issuing such important guidance? And if yes, what assessment has been made of how it is working? Now, Sir Henry, the UK is making good progress in getting people to stop smoking and use e-cigarettes to achieve this. But this is currently at risk from recent concerns about e-cigarette use, particularly in other countries. We've put these concerns to Public Health England. Now, to summarise, first of all, the claim deaths in the US have been linked to the use of e-cigarettes and vaping products. Now, the reality is that the US operates, first of all, in a totally different regulatory context, and I quote, "illicit products were implicated in this outbreak, including vaping cannabis derivatives." This is from Public Health England. Public Health England has also explained that the suddenness of the outbreak across many USA states in just a few months suggests that this is not a gradual effect of long-term use, but because of a specific agent coming into use in the affected population, close quote. Next, concerns have been expressed that flavoured e-cigarettes are luring children into vaping. Now, Public Health England's response explained that data that they had so far was reassuring that e-cigarettes were not renormalising smoking. Further, that the UK and the US have different rules on, first of all, advertising, on nicotine concentration, and on education on vaping, which explains why flavours in e-cigarettes are less impactful in the UK compared to the United States. Next, the introduction of a ban in India on the production, import and sale of e-cigarettes due to concerns about the risks they pose to health and the young. This was an assertion that has been made, which again is at risk of infecting the debate that we have in this country. But Public Health England explained that, and I quote, India is one of several countries that appears to be responding to the outbreak of lung disease amongst cannabis vapers by proposing a ban on nicotine inhalers, and explained that smoking is far more prevalent in India and causes 7 million deaths a year in India. Yes, I give way.
Grateful to the Honourable giving way. Isn't it true that India have a massive vested public interest in the tobacco industry?
Well, I suspect that the Honourable Member knows better than I do, but I note the point that he makes. But it's my view, based on the evidence that we heard as a committee, that the action taken by India is not based on evidence and is likely to result in more people dying of lung cancer. And I think that that's rather shameful. Now, I would encourage all honourable and right honourable members to read the helpful and comprehensive reply we received from Public Health England, which we've published on these issues and others, so that anyone can delve into the detail. Now, I'm reassured that Public Health England is in close dialogue with a range of international partners, and I agree with Public Health England that, and I quote, it is no exaggeration to say that inflating fears about e-cigarettes could cost lives. I also, incidentally, have concerns about the attitude at the World Health Organization, which doesn't take the same evidence-based approach, as far as I can see, as this country has done, which again has implications for the potential loss of life of millions of people across the globe. And it seems to me that people often conflate the fact that we don't have all of the long-term evidence of vaping impact with an assertion that that should lead us to conclude that we shouldn't be recommending vaping as an alternative to smoking. But frankly, that is stupid as a public policy approach, because we know that smoking is killing, I think, over 70,000 people in England every year, and all of the evidence so far shows that nothing like that is happening with vaping, and according to Public Health England, that it's 95% less dangerous than smoking. So the clear public health advice has to be that vaping is an appropriate way to help people to give up smoking. Of course, the best of all is to not vape and not smoke. But if that's not possible for someone, the clear public health advice needs to be that vaping is better than smoking. Can the Minister set out what contact the government or other ministers have had with other countries on international approaches to e-cigarettes? What are they doing, in particular at the World Health Organization, to encourage a more enlightened approach? What assessment has the government made on the effects of these international approaches on public perception in the UK of e-cigarettes? What steps will the Minister take to ensure that this misinformation on e-cigarettes is challenged? Now, in conclusion, Sir Henry, e-cigarettes... Oh, I'm happy to give way.
I'm grateful to my honourable friend. It's not just the World Health Organization that is not using evidence for its advice. It's also the EU. Their directive, both on the size of the bowls used and the amount of substance put in there, is not based on evidence and is likely to mean that those people who are getting a nicotine kick, much less dangerous than cigarettes, don't find the products satisfactory and will go back to smoking.
Well, I thank my honourable friend for that intervention again, and I think I have exactly the same concern as he does about the directive and the prescriptive rules relating to vaping, which don't appear to me to be sufficiently evidence-based. E-cigarettes are positive in helping current smokers to stop smoking, and they are significantly less harmful than smoking conventional cigarettes. Yes, there are unknowns about long-term risks, and we need to maintain research on e-cigarettes. But doing nothing is not an option when people's well-being and lives are at risk. And I really look forward to the contribution of other honourable and right honourable members and to the Minister's reply. Thank you very much indeed.
Thank you very much indeed. The question is, this House has considered the 7th report of the Science and Technology Committee, e-cigarettes, House Commons 505/2718, and the Government's response, Command Paper 9738, 2017-19. And I now call Bill Grant.
Thank you very much, Sir Henry. It's a pleasure to serve under your chairmanship this very afternoon. And I would like to congratulate my right honourable friend, the member for North Norfolk, in securing this important debate. Members, e-cigarette use in the UK has followed a gently rising trend over the last few years. And last year, ONS statistics showed 6.3% of those over 16 were indeed regular users, a rise of less than 1% over 5 years. In our August report in 2018, the committee concluded that e-cigarettes should not be viewed in the same way as conventional cigarettes. They are an effective stop-smoking aid and should be formally considered as such. In its response to the letter sent on behalf of the committee by the Chair, Public Health England confirmed it believed, as the committee did, that e-cigarettes are around 95% less harmful than conventional smoking, as our committee found, and I quote, "A medically licensed e-cigarette could assist smoking cessation efforts by making it easier for medical professionals to discuss and recommend them as a stop-smoking treatment with their patients. Existing smokers would be encouraged to give up, but if that is not possible, they should switch to e-cigarettes as a considerably less harmful alternative. We must acknowledge that there are uncertainties about longer-term health effects of e-cigarettes. E-cigarettes have not been in circulation for long enough for any scientific research to be certain, and that there also has been concerns raised in the United States, as was said earlier, about an isolated outbreak of serious lung injury linked to illicit vaping products. But I suspect, as my honourable friend said, there may be other factors at play in those instances. However, we have not seen this replicated in the United Kingdom, largely believe because, as Action on Smoking Health confirms, we have a strong regulatory system, which is not yet the case in the United States. The government mandates strict conditions, namely a minimum age of sale, ban on advertising in broadcast media, print or internet, and a stipulation that products containing over 20 milligrams per millilitre of nicotine need a medicinal licence. Products must also be child-resistant and tamper-evident, and packs must carry a health warning covering, I believe, up to or over 30% of the surface area. Moreover, to be balanced, any judgment on the future of e-cigarettes must take account of human nature and the most likely alternative to vaping, namely returning to conventional or harmful conventional cigarettes, which we know have proven and serious health risks over time. While some groups would prefer the firmest possible line, Cancer Research UK, for instance, is pressing for a tobacco-free UK within the decade. Most groups agree that e-cigarettes can provide a useful route towards quitting the harmful conventional cigarettes. We have seen clear evidence that e-cigarettes are an effective quitting aid for adult smokers, and crucially, the percentage of young smokers trying e-cigarettes in Britain is indeed small, with continued use smaller still. So they flirt with the e-cigarette but fail to continue on with it. There is little evidence to suggest such products act as a gateway to conventional smoking, In other words, the e-cigarette is not, as some would suggest, a stepping stone to conventional smoking. Far from it. And figures show that almost 3 million people in the UK to date are using e-cigarettes as an aid to quitting conventional and harmful cigarettes. Unfortunately, the committee found that some aspects of the regulatory system for e-cigarettes are holding back their use as a stop-smoking measure. Restrictions on the strength of refills and maximum tank size have led some users to move away from e-cigarettes and return, sadly and most regrettably, to conventional smoking. There seems to be little scientific basis for these limits, and I am pleased that the Government, in response to our report, intends to consider these anomalies and how best to address them. It is good to see that the Government also agrees with our conclusion, and I quote, "There should be a shift to a more risk-appropriate regulatory environment where regulations, advertising rules and tax duties reflect the evidence of the relative harms of the various e-cigarettes and tobacco products available." Such a move might well bring about the welcome improvements in health that we as a society so desperately seek, particularly from lung cancers and other aspects or byproducts, if you like, and unintended consequences of smoking. It's proven beyond belief smoking, or conventional smoking, is harmful. I would look forward to seeing some of these changes implemented. And if I might take this opportunity to speak directly to conventional smokers, and despite being a fire officer for 31 years, sadly, I was a 50-a-day smoker for many years. Though long since stopped, believe me, being a smoker was a costly, smelly and unhealthy mistake in my life. And I only realised this afterwards. And yes, like the smoker today, I enjoyed them then as you do now. And even in my time in the fire service, when you left the fire with your breathing apparatus on and you pulled the face mask on, some kindly colleague would have a pre-lit cigarette for you. If that was madness, well, it was certainly madness at the time, and I indulged in it. It's not easy to smoke, but anything that is good is not always easy. Believe me, it can be done. So my plea to those who do smoke, you can stop if you put your mind to it. And it is absolutely worthwhile.
Can I just say that he kept that information very quiet on the side?
It's neither something, thank you for that intervention, it's neither something to be proud of or ashamed of. It was a culture of its time. I was part of that culture, and I am delighted. Two things in life that I've never regretted doing was marrying my wife Agnes and giving up smoking, so they're equally wonderful. In closing, I have had the pleasure to serve in the Science and Technology Committee since shortly after I was elected to this House. And it has been my most fascinating and inspiring journey. And I'm incredibly proud of the work we have undertaken as a committee, ably assisted by a very fine secretariat, and I wish to put on record my thanks to them for their support. Indeed, as my right honourable friend, the member for North Norfolk, and I both intend to retire the forthcoming election, this will be our final debate together, and I wish to thank him for his fine stewardship over the 2 years. Thank you very much, Sir Henry.
Kevin Barrett.
Thank you, Sir Henry. I'm really happy to be here this afternoon and giving my last speech in Westminster Hall as well. And something that I've been looking forward to for quite a considerable length of time, since something happened in 2016, which I don't want to mention. But nonetheless, I'd just like to say, first of all, that I've been quite active in smoking cessation over many years in this Parliament, that this is a good report, well-sourced and well-evidenced about where we should be moving in the future now to reduce and protect our fellow citizens. Could I admit two things? One is, it's a bit of a confessional. Over 40 years ago since I stopped, but I used to smoke cigarettes as well. I was quite addicted to it. The other confession is, I ought to say, although there's no money in this, that I'm an honorary fellow of the Royal College of Physicians, so I just want to mention that. What the report says is quite clear, that e-cigarettes have proven to be a unique opportunity to increase the decline of smoking rates in this country. And in comparison to conventional tobacco cigarettes, e-cigarettes lack the dangerous tar and carbon monoxide components. Subsequently, e-cigarettes are, as Public Health England say, 95% safer than smoking cigarettes. And it should also be noted that e-cigarettes second-hand vapour is substantially less dangerous than in tobacco cigarettes as well. And e-cigarettes do, as I think we all know now, could and currently do operate as a pathway from conventional smoking to quitting smoking altogether. And at present, there's somewhere in the region of 2.9 million Britons use e-cigarettes as a pathway towards quitting, with tens of thousands successfully stopping each year. I think we were all surprised, not in the current tobacco plan, but the one before, that we went well below the target that was set for adult smoking to be below 16% now, which is an extraordinary thing. Sadly, it wasn't a part because e-cigarettes were put into smoking cessation programs, but my view is that should be the future. But it was because millions of our fellow citizens were buying these products themselves and going down that road as well. And that is no mean feat to get adult smoking to below 16% in this country. That said, I think it is worth mentioning as well, there's still over 80,000 of our fellow citizens die premature deaths each year from using tobacco, and we should never forget those types of statistics. Anything else that was taking lives in this country at that level on an annual basis, we would be up in arms about them. If anything at all, this House would have been operating more than it has done in the past in trying to stop that. The brief for this report from Cancer UK recommends that e-cigarettes are utilised as a tool to aid smokers who wish to quit to achieve their goal. And as it rightly points out, and the chairman said so as well, that unfortunately surveys have shown that 40% of clinicians are uncomfortable recommending e-cigarettes to their patients, with a further third being unsure if they're safe to recommend in the first place, notwithstanding what Public Health England says about these products. Moreover, just 30% feel that their knowledge is sufficient enough to advise patients on vaping. Healthcare professionals must be made aware of the benefits of e-cigarettes in aiding people to quit. And the reality is that vaping, whilst not being completely risk-free, is significantly safer than smoking conventional cigarettes. And they do go on to say that healthcare professionals must be made fully aware of this to ensure that their patients have the strongest chance of quitting smoking. Now, it is very difficult. It's not going to be necessarily something that hopefully new doctors will be, or doctors in training will be looking at things like this. But I say to this, if any health professionals are either in this room or any health professionals read this debate, they could do worse. Certainly a GP, a general practitioner, could do worse than just go around to the local vaping shops on the high street and go in and talk to the people who sell the products in there and ask them. They trace their patients. They know their patients that might have been on 50 cigarettes a day and they're down to none. They know their patients that were on higher hits of nicotine in the product and it's lower and lower now. I know people who still vape, but there's no nicotine in the product at all. So they're not satisfying an addiction anymore, but what they are, it's just a habit and using hands, etc. And that's what we ought to be doing. And it's quite true to say that there's no long-term evidence, as there wasn't when there was first had a heart transplant in South Africa. But it's pretty clear that there is evidence out there in our communities. And what we need to be doing is getting the health professionals to go and talk to these people who have been dealing with probably their patients as well over a length of time. Naturally, many people have raised deep concerns over whether vaping can operate as a gateway into the smoking of conventional tobacco cigarettes, but there is no evidence that that is taking place at the moment. It suggests that this phenomenon has materialised in any meaningful demonstrative way. And I've been very active with Action and Smoking and Health over decades now in this country, and they are watching this on an annual basis about what's happening, particularly around young children as well. There's no evidence that this form of metered addiction is actually bringing people into nicotine addiction and passing them further on to cigarettes themselves. And I have to say that some of the evidence we've had, about vaping in America, you must look, some of this stuff is Class A drugs that they're putting into these things. This is why we're having deaths. It is true to say, and I know this from going to America from time to time, I've got 2 step-grandchildren out there, that going from America time to time, one of the companies, who shall be nameless for this debate, have been promoting vaping to young children, flavours and everything else like that, not necessarily nicotine addiction. They'll be promoting it to young children. You talk to the schools about that, they're up in arms about the nuisance and the litter that these things take place. So there is something, but we shouldn't be too scared of it. I just want to finish really on 2 more things now. Although there are advertising restrictions and regulations on vaping, they are less stringent than that apply to tobacco products, and that is true. Earlier this year, the House of Commons Library published a briefing paper in June on advertising vaping and e-cigarettes. It's well worth reading that to find out. I first started on anti-tobacco in the 93-94 session when I ran a private member's bill to ban tobacco advertising and promotion. And we've moved on in a long way down the road from that now, but there's still lessons to be learnt from that paper in relation to how these products are advertised. And as the committee said, they recommended that cigarette packet inserts could be utilised to refer smokers to e-cigarettes as a healthier alternative. And unfortunately, at the moment, Minister, the present standardised packaging of tobacco products regulations bans actually this happening. And I think that we need to have some quick thoughts about this. These are the people who are addicted to cigarettes or going into shops who are buying these cigarettes in there. And they're the people that we should be targeting. I know we can do it on websites and things like that. It should be targeted to these people who are going in there. And I think that we could change that. I can't because I'm off. But we could change that regulation in this country in super quick time so that we're in a position to get to these people who are still addicted. And I just want to finish on this. It has been mentioned about smoking cessation programmes, and I think that it needs to be endorsed now that these products should be a mainstream in smoking cessation programmes. I visited Leicester smoking cessation programmes about 3 years ago now, who've been at the forefront of using these different products. They got a wonderful scheme, led by a nurse at the time, where pregnant women were being on the vaping for at least for the time of that pregnancy. The life chance that has for that child is it is greatly enhanced in terms of healthier life and everything else because of that time. There's no reason that we shouldn't be doing that mainstream now. I know we're going to refer people who smoke when they go to hospital now into community pharmacy, and I say that's a good thing as well. But nonetheless, we should be looking at specific interventions with these products there to people who are vulnerable, and like unborn children who are clearly vulnerable as well. And just to finish and say this, Minister, we ought to be funded directly from the tobacco industries into smoking cessation programmes. I know that will be an issue for the Treasury, you need to talk to that. But we often talk about pollution, about polluter pays and everything else. Tobacco companies should be paying for our smoking cessation programmes. And sadly, and we've said this in debates before, that some of them are just fading away now. And there are some parts of this country where there's still heavy, intense smoking by adults, have no smoking cessation programmes at all. And it is wrong. And at over 80,000 deaths a year, it should be stopped.
Gareth Johnson.
So, Henry, unlike the last three speakers, I rather hope this is not my last speech in Westminster Hall. But that's up to the people of Dartford. That's not up to myself directly. I'm very pleased to be able to contribute to this debate, actually, because I feel very, very strongly that vaping is something that we should be embracing as a country. You know, we've heard mention about Public Health England saying that vaping is 95% risk-free, which is really significant statement. But it's not just Public Health England that have made these statements. We have cancer research that have said that there is significant benefits from vaping compared with the consumption of tobacco. We've had ASH, we've had the British Heart Foundation, the British Lung Foundation. These are people who traditionally frown on anything associated with smoking, and understandably so. But they have recognised the fact that vaping saves lives. And that is what we're talking about here. And the sooner that we recognise as a country that, look, we have this product, this invention, that could save thousands and thousands of lives just in the UK, let alone around the rest of the world. The sooner that we recognise that as a country, the sooner we can start saving the maximum number of lives possible. And it is therefore with great regret that we've heard these stories coming out of the United States. It's only when we started drilling down into those stories and we saw that this is potentially linked to acetate and to cannabis oil and so on, and that is actually the irritant that is causing those deaths, that we recognise that, look, we shouldn't therefore allow those tragic circumstances to cloud people's image of vaping, because he's absolutely right. It's not just clinicians who are unsure as to whether or not they can recommend vaping to patients, but it's also the general public who are unsure whether or not vaping is as safe as some of the experts have said about vaping. We need to ensure that we educate people and say that there is this well-known knowledge, well-known fact that tobacco is seriously damaging to your health. It is highly risky. However, we have vaping there where the risks are substantially less. No one is suggesting in this debate, or anywhere at all in the House of Commons that I'm aware of, that people who do not smoke should start taking up vaping. No one is suggesting that. What the suggestion is that people who smoke, people who actually are addicted to tobacco, addicted to nicotine, they are the people that will benefit from this. There are still risks associated with pretty much anything, and vaping is no exception. And so, therefore, the message is loud and clear. People who do not smoke should not start vaping. However, people who do smoke may wish to try the alternative of vaping as a very effective way of actually either reducing their tobacco consumption or completely coming off of tobacco in totality. And so, therefore, I actually welcome what we have seen from some tobacco companies, where they have embraced vaping. They are realising the potential that vaping has. There is a company, JTI, that have highlighted to me about some of the dangers associated with the products that do not contain nicotine, and therefore do not come under the tobacco-related products regulations, and therefore can be targeted at children. They can be marketed to look like food, to look like something that's trendy, that's something that people want to get involved with, and yet they do not have to comply with the regulations, and therefore it's not known what the ingredients are of those products. And that is something that we need to look at. The tobacco-related products regulations, which I know the committee that's chaired by the Right Honourable Gentleman has looked into, has some serious flaws with it. For a start, it should not be lumping vaping and tobacco products together. There should be separate regulations for the products. That would enable an end to the ridiculous situation where someone can buy a vaping product that has no nicotine in it whatsoever, but there has to be a warning on the front of that product that says this product contains nicotine, when it doesn't. And yet, if they don't put that warning on there, they fall foul of those regulations. But if they do put the product on, they fall foul of other regulations. And you have this crazy situation that has grown up. We also need to look at whether it's right to have more advertising. I believe that it is. The regulations seem to prevent that. I think it's right that we enable people to be educated and aware of the products that are available and the potential benefits from it. So I don't want to make this debate turn into a debate on Brexit, but there's no getting away from the fact that once we leave the European Union, we will, as a country, be able to look at the regulations ourselves and see what best suits our needs and what is sensible as an approach to people vaping, and where we can ensure that people are aware of this, where people can benefit from vaping. We should ensure that that actually takes place. You know, I have met with a number of organisations that are trying to push forward a change in vaping regulations. Imperial Tobaccos, I know, are doing a lot. The company called Blue, I know, are pioneering in the products that they are producing now, and that is part of the key to this. They are putting a lot of investment into producing products that will be attractive to smokers, in so much as that they will satisfy them and therefore feel less necessity to smoke cigarettes. You know, I don't want to demonise smokers in all of this. If an adult, knowing the risks of smoking, chooses themselves to smoke, that is their decision. But I think it's incumbent upon the government to ensure that people are aware of the alternatives, aware of the risks of smoking, and the comparatively less risk associated with vaping. And so the government is rightly now pursuing a target of reducing the number of people and eliminating the number of people who are going to be smoking in this country. It is a very, very ambitious target, and I think in order to achieve that target, it is necessary to introduce people to vaping through GPs. Yeah, certainly, I'll give way.
This issue about that smoking is an adult thing. Very few people start smoking once they get to the age of 21. If you look at the hard reality, it comes when they're quite young. I think I was about 11 or 12 when I started getting addicted to nicotine. So I think we have to be very careful about that. It's not really an adult choice. It's just something that adults do from a very early age.
I totally agree that whilst we do not I think I take the view that if adults want to smoke and if that's their decision, knowing the risk, then that's up to them. But there is a duty of care on the government to ensure that tobacco products are not consumed by children. That is absolutely clear. And I think it's right that we keep the age of 18 to those people who are allowed to vape as well. We do not want to be seeing vaping products targeted at children either. No responsible vaping company would do that and has done that in my experience. And so if I can conclude, Sir Henry, I do think that there is a sensible approach here from the government. I do believe that they can embrace the potential that we have here to save lives through vaping. There is so much potential through a taxation system, through advertising, through education, through making people aware of these products, to make these products more accessible. And just recognising the fact that for the first time in my life, there is genuinely something that can help people to get off of smoking tobacco that is effective, that works. If you look at a graph of the number of people who smoke in this country and the number of vapers in this country, there is a direct correlation between those two figures. The more people have been vaping, the less people have been smoking. And that is something that we need to be highlighting, we need to be celebrating that, and it's something that the government should take forward.
I haven't put in a card, but I would like to say a few words.
Yes, indeed. Jane Dodds.
That's right. Thank you. I really just wanted to draw attention to the correlation between people who have mental health difficulties and their aptitude to smoke. And I would at this point just like to pay tribute to my friend and colleague Norman Lamb, who has really championed the cause of mental health throughout the time that you've been here. And I hope that the committee won't mind that indulgence. Thank you so much, Sir Norman, for everything you've done. This issue I know relates to England, and I'm a Welsh MP, but I would just like to draw attention to the issue of cross-border healthcare. Many residents from Wales, if they have a need for a residential mental health unit, have to travel to England. And of course, there's a complete disparity there between the practice in Wales and that in residential units in England. And I'd just like some thought from the committee. I do realise that this is not within your brief totally, but some comment about how there could be some marrying up of the policies around mental health units in England and how they have these particular rules and regulations around the access to e-cigarettes to those in Wales. There are significant differences. We talked earlier about international, learning from international bodies and countries around the world. But actually there is a need, in my view, to look at the whole of the UK and how we can get some parity across the nations. Thank you very much. Diolch yn fawr iawn.
Henry, it's a pleasure to serve under your chairmanship this afternoon. And I do apologise if I sound a bit croaky because I've got a cold, which I think is going around. Hopefully I'll get rid of that for what's to come over the next few weeks. So I'd like to start by thanking the Honourable Gentleman for North Norfolk for introducing this debate and for his characteristically well-informed speech. It's sad to think that that could very well be his last speech as an MP and what has been an illustrious career, but I'm sure it won't be his last speech as a campaigner or indeed an activist. I'd also like to congratulate him for his work chairing the Science and Technology Committee and for this excellent report. I'd also like to thank all the other honourable members who've spoken, the member for Ayr, Carrick and Cumnock, Rother Valley, another honourable friend who I've enjoyed working with over many years, who has also had an illustrious career and was an excellent chair of the Health Select Committee for a number of years. He will be sorely missed in this place, and there were other speeches also from the members for Dartford and the Honourable Lady who's just spoken, and I didn't catch her constituency. Excellent. There we go. Thank you. Very good. Thank you. So, as we've heard, there is some uncertainty still around the use of e-cigarettes. They've only entered the market, the UK market, 12 years ago, and this technology is still so young that we don't really know for certain its long-term impacts on health. But what we do know is that e-cigarettes are around 95% less harmful than conventional cigarettes, and because of that, an estimated 2.9 million people in the UK are using e-cigarettes to stop smoking. And each year, tens of thousands of people are successfully using e-cigarettes to quit smoking. A randomised control trial published in the New England Journal of Medicine earlier this year found e-cigarettes used in a stop smoking service to be nearly twice as effective as licensed nicotine replacement therapies like patches and gum. And the importance of e-cigarettes as a smoking cessation tool should therefore not be dismissed. However, this must come with the caveat, and I think everyone's making this point, that using an e-cigarette is not completely risk-free. We have seen recently in the US an outbreak of serious lung injury linked to vaping. However, this has not been replicated here in the UK. There are 3.6 million current vapers in the UK, yet the number of cases of severe respiratory pathology associated with vaping is low and diverse, with reports over a long period of time. So I agree with the recommendations by Ash that e-cigarettes users should only buy vaping products including e-liquid from mainstream suppliers who are selling regulated products, because using black market products may potentially carry lethal risks. They should report any adverse effects from e-cigarettes they're using to the Mhra using the Yellowcard scheme, and if they are experiencing serious adverse effects which they think are due to vaping, they should immediately stop vaping and get advice from their doctor. So has the Minister considered launching an e-cigarette safety education programme that will ensure that e-cigarette users know the risks and what to do in case anything goes wrong if they manifest any of these symptoms? This may help lessen the possibility of manifesting the same patterns that we are seeing in the US with lung injuries linked to e-cigarettes. I'd now like to return to recommendation 4 of the committee's report, Sir Henry. The committee recommends that NHS England should issue e-cigarette guidance to all mental health trusts with the default of allowing e-cigarette use by patients. Now, as we've heard, people with mental health issues smoke significantly more than the rest of the population and could therefore benefit significantly by using e-cigarettes to stop smoking. And encouraging and allowing patients in mental health units who are smokers to switch to e-cigarettes as a means of smoking cessation means that they could continue to engage with their treatment sessions within the facilities without the interruption of smoking breaks. However, a third of the 50 NHS trusts who responded to the committee's survey ban the use of e-cigarettes. So the government has agreed to issue guidance to NHS trusts about e-cigarettes, but it is yet to be published. So can the Minister please tell us when she anticipates the guidance to be published? I know she might have to rush it out in the next couple of days, but she might have a magic wand and be able to do that. Doing so could mean that patients in mental health units can engage more fully in their treatment, and this could improve outcomes. As the committee has found, therefore, e-cigarettes do have a role to play in our society and the government's commitment to achieving a smoke-free generation. However, we must ensure that advice on the safety of e-cigarettes, both short and long-term, is updated regularly and publicly so that users have the most relevant and up-to-date information available to them. The government must also consider the role that e-cigarettes play in mental health services, as we've heard, and improving patient outcomes across the NHS. Every contact does count, especially when it comes to smoking cessation, and none of them should be missed. However, I have to say again, due to the government's public health budget cuts since 2013, which I know this Minister isn't personally responsible for, smoking cessation services have suffered, leaving the most vulnerable smokers behind and without any support to quit smoking. So that must change. Once again, I ask the government to reverse these public health budget cuts so that local authorities can provide the smoking cessation services that their local communities need and deserve. So with those brief few comments, Sir Henry, I look forward to the Minister's response.
Thank you very much indeed. Minister Jo Churchill to reply to the debate.
Thank you very much, Mr Bellingham, and it's a pleasure to serve under your chairmanship. I would like to firstly start by congratulating the Right Honourable Member for North Norfolk for securing this debate, and thank the whole committee for the report, the tone of the report and the intelligent way in which it's approached what is a difficult subject when you're trying to stop behaviour in a way that is detrimental to an individual. And at the outset, smoking is by far and away something that we want to see reducing down to zero and us being smoke-free by 2030. It's a very ambitious programme, but it's one that actually affects the benefit of many more than those individuals who just smoke themselves. It affects others around them. So I would like to thank him, as I've always highly respected him, for the important work leading the Science and Technology Committee, but as well as the broader health work on the health agenda that he's done. And although this might be his last debate in this place today, I hope it's not the last time that I hear him waxing lyrical on the airways on this subject. And I would actually I would like to say the same for the Right Honourable Gentleman for Rother Valley, who really has, both with the Health Select Committee, but also with his work with the APPG on smoking and health, really been quite formative in this area. So it's timely we're having this discussion at the very end of this year's Stoptober campaign, and I pay tribute again to the Honourable Gentleman for his work here in starting it. There's never a better time to stop smoking, and I encourage everybody who's thinking about it to visit their local Stop Smoking service or online and consider all the options available that can help them quit. I am really proud of the tobacco control work that has taken place over the last 2 decades and of the progress made. We have been recognised internationally for this. According to the European Cancer League's tobacco control scale, the UK has been rated consistently as having the most comprehensive tobacco control programme in Europe. And, as we've heard from the numbers discussed, it's working, but we're not there yet. We know that smoking remains one of the leading causes of preventable illness and premature death, with over 78,000 deaths a year. This is not only a waste, but also a very personal tragedy for all those families affected, and we're determined that we should do more, as set out in the Tobacco Control Plan, the NHS Long-Term Plan and the Prevention Green Paper, which did only conclude on the 14th of this month. But I am looking forward to seeing what the results of that consultation is. Because our ambition is to be smoke-free by 2030. We know we need to work harder within certain groups, including pregnant women and those with mental health issues. Like him, I was struck by the extremely high prevalence. The Right Honourable Gentleman mentioned Blackpool, but it's actually, and as he himself knows, having a coastal region, there's a very high prevalence in many coastal areas of pregnant women who are smoking. They interact with a lot of healthcare professionals during what should be the enjoyable, exciting time when they're expecting a baby. We should make sure that we use every single one of those interactions to help them quit during this time. So I have asked officials already to look at whether there are other forms of being able to message to this particular group in a way that constantly helps them understand the risks, but also be aware of what things are there to help them. I also listened to his point for those with enduring mental health issues. Facilities should help allowing e-cigarettes and support more. It's an ongoing part of the agenda, but if I may, I would like to write to Sir Simon Stevens and see where we are and actually let the committee know. Yes, of course.
I'm very grateful anyway, and I thank her for her very kind comments. And I'm pleased she's going to write to Simon Stevens, because I think pressure from government ministers to NHS England to recognise the significance of this subject is really important. But could she also, I'm conscious I asked quite a lot of questions in my contribution, and she may well not be able to answer all of the questions, but can she try to write to me before Parliament rises next week, if at all possible, to answer those questions that she's able to answer, so that we get that on the record?
So, I'd like to thank the right honourable gentleman. I will do my very best, and I hope that you will have that answer winging its way to you on Monday if there's anything that I haven't covered. The government's absolutely clear that quitting smoking and nicotine use entirely is the very best way for people to improve their health. We recognise that e-cigarettes are not risk-free, as has been stated by everybody who contributed. However, they can play an exceedingly important role in helping smokers quit for good, particularly when combined with stop smoking services. It is an addiction, and a step change through your practices and through your behaviours is what we're trying to achieve to enable people to cease and quit entirely. Mr Chair, we don't know the long-term harms for e-cigarette use, and no authorities in the UK assert that they are harmless. However, based on current evidence, Public Health England and the Royal College of Physicians estimate e-cigarettes are considerably less harmful than smoking because of the reduction in levels of exposure to toxicants in e-cigarette aerosols compared to tobacco smoke. But again, I would like to reiterate that quitting smoking is your best option. It would be fair to say that opinions are divided in the UK and globally on e-cigarettes, and it's important that we listen to concerns while looking objectively and seek to build further the evidence base, which I think is the point the right honourable member was making. On the question of research, I would like to assure him that there is a NHSE dedicated lead, a director for prevention in place overseeing the NHS long-term plan commitments. I note my right honourable friend's comments about India and making decisions perhaps too quickly, not based on the research that is available out there, which also has unintended consequences. As the House is aware, in the UK we have introduced measures to regulate e-cigarettes, to reduce the risk of harm to children, protect them against acting as a gateway to starting smoking, which again was an important point made, to provide assurance on relative safety and to give business legal certainty. As far as what has happened in the United States of America, we take those concerns seriously. We're aware of the tragic deaths associated with vaping in the United States and are monitoring it carefully. But Public Health England and the Medicines and Healthcare Products Regulatory Agency are in close contact with the United States agencies. Investigations are ongoing, and they're not able to yet confirm definitively the cause of deaths, although it does appear that the majority of those who have died have used illicit CBD with the THC products, which has led to these unfortunate deaths. To date, there are no known deaths from e-cigarette use here in the UK. The Mhra Yellowcard reporting system is in place to report any adverse effects. It's been running for 3 years, and to date around 85 individual cases have been notified, and these have been minor and none have been considered to be life-threatening. However, I would like to assure both the right honourable gentleman but everyone who has contributed to this debate that we remain extremely vigilant on the issue and are very grateful for all research done in the area. Including that, as my honourable friend from Dartford alluded to, those within the charity sector that do a great deal of this work to actually look at the harms caused. We made strong commitments in our tobacco control plan to monitor the impact of regulation and policy on e-cigarettes and novel tobacco products. To inform future policy, we're looking closely at the evidence on safety, uptake and health impact and the effectiveness of these products as smoking cessation aids. Public Health England will continue to update its evidence base on e-cigarettes and other novel nicotine delivery systems. My apologies. Then coming on to use by young people, which was mentioned by the Honourable Member for Rother Valley and again for the Honourable Member for Dartford. Firstly, the use by the young. This currently remains low at 2%, and we haven't seen the rise that has occurred in the United States of America. However, we will closely monitor the data to ensure regular use doesn't increase and it isn't seen as that gateway to tobacco use. Somewhat linked to the second, we will also keep a close eye on any new evidence on the long-term harms caused by flavourings. If the evidence shows that we need to address either or both of these issues, we will consider taking action, including where necessary, further regulatory action. I would like to see stronger leadership from the industry on areas of e-cigarette product naming and design in particular, to ensure that they don't appeal to young people. Some of the naming does appear to be leaning on the side of appealing to youngsters. So, in conclusion, in the future, we will have the opportunity to reappraise current tobacco and e-cigarette regulation to ensure it continues to protect the nation's health. And to conclude, I would like to thank all members who've spoken here today, in particular the Right Honourable Member for North Norfolk, who will be leaving this House. But as we've seen, it's been a bit of a goodbye party from the Honourable Member for Ayr, who I'm staggered by the revelation that he smoked 50 a day. I wondered that he had time to do very much else, let alone run around being a fireman. So, who will be, and my honourable friend, the member for Rother Valley, but I'm sure all of them will also undoubtedly continue to work in this area. Mr. Chair, I would like to reiterate the government's commitment to helping people quit smoking, which is ultimately the very best course of action, and to seek evidence on reduced risk products. We will continue to be driven by that evidence. Whilst we are able to celebrate that adult smoking in England has fallen by a quarter and regular smoking amongst children has fallen by a half, I personally, and I'm sure all those here, will truly be able to celebrate if we are, like the report aims for and like the government is aiming for, we are smoke-free by 2030.
Sir Norman Lamb to wind up.
Thank you very much indeed, Sir Henry, and I thank the Minister for her response to the debate and for her kind comments. What's striking is that there's been a remarkable consensus in this debate over the action that we're taking in this country and the need for it to be evidence-based. And it's clear that the United Kingdom is ahead of the game internationally in terms of smoking cessation work, and that's something we should celebrate, but we should never be in any way allow ourselves to feel that we've done the job, because we have so much still to do, particularly given the number, as the Honourable Member for Rother Valley made clear in his contribution, the number of people who still die every year from smoking. The carnage, the death toll is just enormous, and so the work needs to continue. We've had wonderful admissions, and can I just say that my two honourable friends who've admitted to smoking heavily in the past are both wonderful living examples of life after smoking, and a good example, less coughing please, but a wonderful example to others about the potential value of giving up smoking. And I also wish both of them a very happy retirement from this place. I just want to pick up very quickly one or two points. I totally agree with the Honourable Member for Rother Valley, and we made this point in the report, that inserts in packs is a very good way of targeting a really important public health message directly at the people who need to hear that message and who need to be reassured that giving up smoking and vaping instead is going to help their health. Secondly, I also agree with the Honourable Member for Rother Valley about the case for the tobacco industry making a contribution towards the cost of smoking cessation services on the basic principle of the polluter paying. My honourable friend, the member for Brecon Radnor, who has had to leave the debate, made some very important points about cross-border health issues. I applaud her for championing access to mental health support in Wales, incredibly important. But the point in this debate is that every mental health facility, every inpatient mental health facility in particular, whether in England or Wales or Scotland, there should be the same access to vaping and support to enable people to give up smoking and using vaping as the mechanism to do so, because we will see significant gains in life expectancy, but also in their mental health by giving up smoking. Smoking harms your mental health as well as killing you earlier. The Honourable Member for Dartford and the Honourable Member for my honourable friend, the Member for Blackley and Broughton, both made the point about the need for regulations always to be evidence-based. And that hasn't been the case. It's not the case with the directive from the European Union, and it's certainly not the case internationally with the debate we've had about the World Health Organization and the approach that's taken in America. But in this country, we want our regulations to be evidence-based to give people the best chance of giving up smoking and having a healthier life. On a personal basis, I stress that this is not in my role as Chair of the Select Committee. I do agree with the Shadow Minister that investment in public health is really important. There is so much evidence that investing in early prevention work of all sorts and investment in public mental health as well, in very brutal economic terms, gives you a return on your investment, but also changes lives. And so the plea for whoever becomes the government after the 12th of December is make the investment in public health, because we will all benefit from that. And on that note, I thank you, Sir Henry, again for your stewardship of this debate, and I wish everyone well for the next few weeks. I'm just very relieved that I'm not fighting to retain my seat in the middle of winter. Thank you.
The question is if this House has considered the 7th report of the Science and Technology Committee, e-cigarettes HC 505 2017-18, and the government response, Command Paper 9738 2017-19. As many as my opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order, order. Suspend sitting.